We all know alcohol can damage the liver. But what if I told you it could also damage your brain permanently? What if years of drinking could change your memory, your ability to think, even your personality? That's exactly what happens in a condition called alcohol-related dementia. It's one of the least talked about consequences of long-term alcohol use, but one of the most devastating. And today, we're going to talk about what it is, how it affects the brain, and what you can do if you or someone you love is at risk. So what is alcohol-related dementia? Alcohol-related dementia is a type of brain damage that occurs due to long-term excessive alcohol use. It's not a single disease. It's a range of brain and memory problems that happen when alcohol harms the brain over time. It affects a person's ability to think clearly, remember things, learn new skills, and manage daily life. And unlike age-related dementia, alcohol-related dementia can appear in people who are much younger, sometimes even in their 40s or 50s. In some cases, this condition includes a specific disorder called Wernicke-Korsakoff syndrome, which is caused by a severe deficiency in vitamin B1, also known as thiamine. So, how does alcohol actually damage the brain? Chronic alcohol use affects the brain in a few major ways. First, it shrinks brain tissue, especially in the areas involved in memory and decision-making. It also damages blood vessels, which leads to reduced blood flow and less oxygen getting to the brain. Plus, it interferes with nutrient absorption, especially thiamine, which the brain really needs to function properly. And it increases inflammation, which, over time, contributes to brain aging and cell death. Over the long run, these effects can cause damage that just can't be reversed. The brain starts to, slow down, memory gets worse, and a person's personality can shift drastically. The signs of alcohol-related dementia can vary from one person to another, but there are some common symptoms to look out for. These include short-term memory loss, difficulty learning new things, poor judgment and decision-making, confusion or disorientation, trouble with balance and coordination, mood swings or even aggression, lack of motivation, changes in personality, and sometimes making up stories to fill in memory gaps, which is called confabulation. These symptoms, they usually come on pretty gradually. At first, it might just seem like normal aging or a little bit of forgetfulness. But as time goes on, they get worse. And without any intervention, they can eventually lead to total dependency on others. So, who's at risk? Alcohol-related dementia is most likely to occur in people who, drink heavily for many years, especially more than 4 to 5 drinks a day. Folks who don't get enough nutrients, especially thiamine, which is vitamin B1, are also at higher risk. If you have liver disease, that really affects how your body processes alcohol, and that can make things worse. A poor diet or other underlying health conditions can increase your risk too. And starting to drink at a young age and continuing for the long term, well, that's another big factor. But honestly, it's not just about the quantity, it's also about consistency. Even moderate drinking over decades can really take a toll. And for people who drink alone or hide their drinking, the signs may go unnoticed until the damage is, unfortunately, pretty severe. Let's briefly explain what Wernicke-Korsakoff syndrome is. One of the most serious forms of alcohol-related brain damage is Wernicke-Korsakoff syndrome, which is sometimes called wet brain. It actually has 2 stages. First, there's Wernicke's encephalopathy, which is a medical emergency and comes with symptoms like confusion, poor muscle coordination, and eye problems. Then, there's Korsakoff's psychosis, a long-term condition marked by severe memory loss, learning difficulties, and something called confabulation, where people fill in gaps in their memory with made-up stories. This entire syndrome is caused by thiamine deficiency, and it's directly linked to alcohol misuse. Without quick treatment, Wernicke's encephalopathy can actually be fatal, and once Korsakoff sets in, the brain damage is, sadly, often permanent. Can alcohol-related dementia be reversed? Well, the answer is complicated. Early on, some of the damage may be slowed or even partially reversed, especially if alcohol use stops and treatment begins quickly. But if it's caught late, many of those cognitive changes become permanent. Stopping alcohol use is, without a doubt, the #1 step in preventing further decline. Treatment might include thiamine supplementation, a healthy and nutrient-rich diet, cognitive rehabilitation therapy to manage behavior and mood changes, and, of course, support groups for both the individual and their loved ones. But, honestly, without sobriety, recovery is really unlikely. The brain just cannot heal while it's still under attack. As sensitive as this topic is, you might be wondering, how can you actually support someone with alcohol-related dementia? Well, here are a few ways to help encourage medical evaluation, especially if memory changes or confusion are showing up. Don't shame or blame. This is a medical condition, not just a lifestyle choice. Help them access addiction treatment or support groups. Create a safe, structured routine to reduce confusion and improve daily function. And importantly, take care of yourself too, because caring for someone with dementia can be emotionally draining. Just remember, you can't force someone to change, but your compassion can really be the first step toward hope. Alcohol-related dementia isn't just about memory loss, it's about lost potential, lost time, and, in many cases, lost lives. But it doesn't have to end that way. Early intervention can save years of life and brain function. Sobriety can truly be a second chance, and understanding can break the cycle of shame and silence. If you or someone you love is struggling with alcohol and memory changes, please don't wait. Reach out. Get help. The brain can't wait, and neither should you. If this video gave you value for your time, please like, share, and subscribe.